समटाइम्स लोग जो है कंफ्यूज हो जाते हैं कि ये वेट लॉस के लिए है। वेट लॉस के लिए सेमाग्लुटाइड हायर स्ट्रेंथ में है 1.7 एंड 2.4 मिलीग्राम। ये वंस ए वीक इंजेक्शन है। टाइप 2 डायबिटीज के लिए 0.25, 0.5 और 1 मिलीग्राम में 10 करोड़ में से ऑलमोस्ट 77% का ग्लूकोज कंट्रोल में नहीं है। Now, this is a very effective treatment. First of all, it is actually for type 2 diabetes. And there are enough patients in India, 100 million people with diabetes in India, who would require the benefit of this medication in 0.25, 0.5 and 1 milligram. Of course, many of these patients are also have heavy weight. That means 7 out of 10 also have weight. So while on one side it is an effective glycemic control agent, reduces HbA1c by 2.8%, but also it reduces weight for those patients who have type 2 diabetes. So holistically, there is a weight loss, there is a HbA1c control, there is a CVD benefits which also come, and also the kidney benefit which also come with this medication. We are very sensitive about the Indian socio-economic class, and I'm very pleased to introduce this at a cost of 2,200 rupees per week. To start with 0.25 is just rupees 8,800 rupees. And I think so this is called as India tailored pricing. And I believe that with this kind of a pricing, more and more patients across India can take the benefit of this medication if prescribed.
Then the comparison with the Mounjaro, so how you would like to speak about it?
I would say I don't think so we are in a competition game or we are in a number game. We are in a game or in a play to defeat diabetes and defeat obesity. And that is what our mission and vision is. We have got enough patients, 100 million, 250 million in obesity. And I think so what we have to compete is we have to compete with the disease and disorder. We would like to bend this curve, which is actually growing with the economic prosperity. You see the diabetes is growing and the obesity is growing. What we would like is, can we arrest that growth? Can we decline this curve? And that is what we are aiming for.
Sir, as we can see that there is childhood obesity also. So are you going to planning to bring something in the future which is related for the child obesity as well and child diabetes also?
For childhood obesity or type 1 diabetes, we have got the ranges of insulin which is actually available. But semaglutide is right now not indicated for type 1 diabetes. And one should have a caution on that.
So would you like to give a message to the people that it should be prescribed based and or should be opted for the type 2 diabetes more?
And that is what we actually come out in the media. First, that the awareness of the medication is so much that we don't want people to go to the pharmacy before they go to the doctor. I think they should go to the right doctor and go to the pharmacy to secure this medication when prescribed. It is not an excuse medicine. It is not a medication that somebody can take and can manage diabetes without diet and exercise. I think people have to be very mindful that it's a triad. While medication is very effective, but one has to also take care of their diet and exercise, and we have been always advocating that.
सर, आज ओजेम्पिक जो है इंडिया में लॉन्च होने जा रहा है, क्या इसकी कॉस्ट रहेगी और किस तरह से इसका यूज़ किया जाए? टाइप 2 में यूज़ किया जाता है, लोग इसको ज़्यादातर वेट लॉस ड्रग से कंपैरिजन करते हैं, क्या कहिए इस पर?
यह जाहिर है एक्चुअली ओजेम्पिक इतना फेमस हो चुका है और समटाइम्स लोग जो है कंफ्यूज हो जाते हैं कि ये वेट लॉस के लिए है। वेट लॉस के लिए सेमाग्लुटाइड हायर स्ट्रेंथ में है 1.7 एंड 2.4 मिलीग्राम। ओजेम्पिक इंडिकेटेड है टाइप 2 डायबिटीज के लिए। ये वंस ए वीक इंजेक्शन है। टाइप 2 डायबिटीज के लिए 0.25, 0.5 और 1 मिलीग्राम में। नाउ 10 करोड़ लोग भारत में डायबिटिक हैं। 10 करोड़ में से ऑलमोस्ट 77% का ग्लूकोज कंट्रोल में नहीं है। नाउ दिस इज अ वेरी इफेक्टिव ट्रीटमेंट। 2.8% HbA1c reduction, glucose reduction. I think that is very, very powerful. Along with that, when they take, they also reduce weight. उनको हार्ट का भी बेनिफिट होता है, उनको किडनी का भी बेनिफिट होता है, बिकॉज डायबिटीज जो है मल्टीफैक्टोरियल है. इट इज नॉट जस्ट टेकिंग मोर कैलोरीज एंड देन यू कैन हैव ए डायबिटीज. इट इज अबाउट secretion of insulin by pancreas, आपके लिवर से भी ग्लूकागॉन जो सीक्रेट होता है उसके कारण, टिश्यू लेवल पर यूटिलाइजेशन के कारण. एंड आई थिंक इट addresses many of the factors of diabetes control